Hello and welcome to the Unit 2 lesson on the nursing process. So the nursing process is used to identify, diagnose, and treat human responses to health and illness. The nursing process is a tool used consistently with nurses with every patient encounter. It is essential that you learn and understand how to apply the nursing process. The next two slides are your learning objectives for this lesson. There are a lot of them. That is how important this topic is. So the nursing process, like we said, is used to identify, diagnose, and treat responses to health and illness. This differentiates the nursing process from the medical process, which treats the illness itself. The steps of the nursing process can be remembered using the ADPI acronym. A is for assessment, D for nursing diagnosis, P for planning, I implementation, and E evaluation. The first step in the nursing process is assessment or data collection. Assessment includes a physical examination along with observation skills. So you want to look for cues from the patient. Does the patient appear short of breath? What's the patient's perception of the problem? What about the family's perception of the problem? It is important to always validate the data to make sure it's accurate. Make sure your observations, what the patient or family is telling you, and what your physical assessment shows make sense with one another. Data can be grouped with like or related data. This is called data clustering. Analysis is looking at the data you've collected and applying critical thinking. Make sure you have all the data you need to make a plan of care. For example, if your patient has a fever, do you have the results of the CBC? The white blood cells indicate infection. You also want to sort out the normal from the abnormal data and look for patterns. For example, the patient's blood pressure is elevated today, but his last 3 blood pressure checks were within normal range. Think about what that means. What might be causing the elevated blood pressure today? Maybe it's medications, diet, or emotions. There are 2 types of data, subjective and objective. Subjective data is what the patient or family reports. These are symptoms. This is charted the same way it's reported, using, in quotations, the patient states and then what they state. Objective data is what you observe during your physical assessment. These are the signs. For example, a sign of nausea might be retching. When interviewing, look for cues by observation. Introducing yourself and gaining the client's trust is important because a client is more likely to tell details of their situation when rapport is established. Direct closed-ended questions such as are you having pain allow for a focused, quick assessment. These questions leave little room for the patient to expand on what you're asking them. Indirect, open-ended questions such as tell me about how that made you feel gives the patient opportunity to explore their feelings and explain what they need to tell you. It is important not to brush over questions. If a patient states he's not checking his blood sugars at home, expand on this. Ask if the glucometer works. Does he have lancets? Does he have medications? What type of diet does he follow? So stop here. Take a few minutes to answer these questions. Think about them and then you can move on. You've analyzed the data you've collected. Now comes the step of stating your conclusions in the form of a nursing diagnosis. It is important to use nursing diagnosis and not medical diagnosis. For example, headache is a medical diagnosis, so your patient is here for a headache. You develop a plan of care using that information. After your interview and exam, you develop your nursing diagnosis using PES format, which is problem, etiology, signs, and symptoms. Rather than diagnosis of a headache, a nursing diagnosis would read problem, acute pain, evidenced by complaint of global headache, with signs and symptoms of grimacing, pale, and rating pain of an 8 out of 10. So how do we separate a medical diagnosis from a nursing diagnosis? Medical diagnoses relate to disease processes and their pathology. It's outside of a nurse's scope of practice to form a medical diagnosis. The nursing diagnosis describes how a person responds to their health problem or life process. This falls within the nursing scope of practice. And just a side note, these pictures aren't meant to be gender biased or stereotypical. It's just hard to find art that is not that way. There are 3 types of nursing diagnosis. An actual diagnosis means the patient has the problem. For example, the patient has a headache right now, so the diagnosis would be acute pain related to complaints of globalized headache, as evidenced by rates pain at an 8 out of 10. An actual diagnosis has to be in PES format, so it includes the problem, what contributes to the problem, and the signs and symptoms of the problem. A risk diagnosis means the problem has a good chance of developing, but hasn't yet. For example, a patient who is immobile is at risk for skin breakdown, so the diagnosis would be risk for impaired skin integrity, as evidenced by immobility. Note that the signs and symptoms are needed for a risk diagnosis. But the etiology necessarily isn't. A wellness diagnosis focuses on a patient's strength. For example, a newborn with a feeding disorder. The diagnosis could be readiness for enhanced family coping. An example of an inaccurate nursing diagnosis would be lack of adequate nutrition. The diagnosis should be imbalanced nutrition, less than body requirements. This slide breaks down the actual components of a nursing diagnosis. We'll discuss this more in class also. The problem is the patient's NANDA diagnosis. The etiology is what contributes to the problem and must be treatable by nursing. And signs and symptoms are the defining characteristics of the problem, not the etiology. So pause here and practice. What I want you to do is write one nursing diagnosis for a patient admitted with a stroke, and then we'll be prepared to share these diagnoses in class. The nursing care plan is a culmination of data collected, which is your assessment, the nursing diagnosis, outcomes, nursing interventions, and evaluation of the interventions. It tells staff how to manage the patient based on the patient's individual needs or problems. So remember our discussion last week of Maslow's hierarchy of needs? This applies to nursing interventions and care planning also. We always want to attend to high priority life or death needs first. These are any needs that would result in harm to the patient or others. Also consider what the patient feels is a high priority. Intermediate priorities are addressed next. These are things that aren't life or death but should still be attended to, such as imbalanced nutrition. And then low priorities can affect a patient's future but are not pressing, so should be addressed last. So without a measurable outcome, it's difficult to evaluate whether the interventions were successful or not. Outcome goals are broad, such as the patient will have a normal bowel function, but outcome criteria must be SMART. This is specific, measurable, achievable, realistic, and timely. And they're related to the problem, or the P of PES. So if the problem is constipation, the outcome criteria should be patient will pass 1 moderate soft BM by discharge, rather than simply the patient will have a BM. Nursing interventions are anything nursing staff does for a patient in the plan of care. Interventions should be safe and appropriate, achievable, in line with the client's belief systems, align with other therapies, and conform to current standards of care. Each nursing intervention should be evidence-based and should include a rationale. Evidence-based means there's research or evidence to support it. It also must be something that falls within the nurse's scope of practice. These are types of interventions you develop in your plan of care. Independent nursing interventions are interventions that nurses are licensed to implement based on their education and experience. Provider-initiated interventions are interventions that require a provider's order or a protocol, but also require nursing knowledge to perform. And then collaborative interventions require a multidisciplinary approach to complete. Implementation is the action phase of the care plan. This is where you perform the interventions you established, and it's collaborative. Performing the intervention allows you to reassess the goals, make certain the intervention is relevant to your patient, and your patient understands what's expected. Be sure to document what is done. Coordinate interventions for the patient. Gather equipment and staff needed to anticipate complications and perform tasks in a timely manner to allow for rest periods. So if your patient needs to perform cough and deep breathing activity, coordinate that with getting the patient up to the chair, or incorporate bathing and walking so that once the patient's back in bed, they can actually rest. You want to help the patient recognize and cope with stressful situations. Provide emotional, intellectual, and spiritual support. Involve the patient. Remember that the nurse is responsible for teaching the patient and family about the interventions. The care plan is designed to engage the patient in a partnership with staff to achieve goals. Engaging and involving the patient is patient-centered care, and it makes the patient more likely to be compliant with the plan. Tell your patient the goals. Provide rationales. A patient with severe surgical pain is more likely to cough and deep breathe if they understand that this is to prevent pneumonia, rather than if they're just told to do something that causes them pain. Excuse me. So take a few minutes to pause here and answer these questions. And we can discuss these in class as well. So evaluation takes place after the interventions have been carried out. The evaluation can only be done by the RN. It looks at whether or not the interventions were effective at meeting the outcomes as they were stated and on the data that was specified. Have there been changes that require the care plan to be changed? Have goals been met and can be dropped off the care plan? Outcomes that have not been met may have had the wrong interventions, wrong outcomes, or the interventions may not have been implemented correctly. In any event, they need their interventions revised. So just remember to review, ADPI is a good acronym to remember the steps of the nursing process. Thank you, and that concludes this presentation.